So we are now beginning recording. Just want to make sure everyone knows that you are being recorded at this point in time. If you have questions, please enter them into the chat box. Thank you, Mr. Bedington, for posting that in there. In the meantime, let's go ahead and get started. So we received feedback from the surveys last week that were rolled out. It was actually really helpful for us. There are some changes that we've incorporated into the structure of this meeting. We're going to keep it to 30 minutes, start it right at time at 9 a.m. and follow a format for most of the updates that we do from here on out. And of course, now my PowerPoint isn't working. Give me 2 seconds here to fix this. All right, can everyone see this okay on the screen? Tiffany, maybe if you can just give me a thumbs up or something that you can see the PowerPoint on there.
We're with you, Brian. We can see the PowerPoint.
Great, thank you. Okay, so I'm just going to go through this way, and again, you should be able to, we'll send out this PowerPoint to everyone on the call after we're done. So, quick overview here. We're going to be covering the updated guidance. If you're just joining us, you can please make sure to mute. There's a lot of background noise going on here. I will try to shuffle through the contact list and cover that on my end. We'll be covering the new guidance that just was released from the CDC, doing some vaccination updates, going through case counts and outbreaks, testing, and some other. So just in case you haven't seen it, there was new guidance that was just issued from the Centers for Disease Control and Prevention earlier this week around return to school. We're going to go through some strong bullet points on that, and we'll be doing a lot of updates over the next couple of weeks around the details of all that, so we can keep you all informed and make sure that we're addressing any questions and or any other specific points that are needed in relation to that. The biggest thing to emphasize with this is that it's really founded on strong mitigation. That is emphasized over and over again in that documentation. And I'm actually going to slide this over here so y'all can see the website. So this is the Direct New Schools and Child Care Programs website that just launched from the CDC. It's supposed to be coupled with the Department of Education guide on COVID-19 return. There are a ton of details in here. Again, we're going to be bulleting out all of this information for you so that it's super easy, quick to understand. The printable posters and graphics are really great resources. I think they did a really great job of getting this into a condensed format that's easy to follow. The Q&A call that took place last week is also really helpful, and you'll hear a lot of specific things mentioned in that call that you're going to hear from us today as well. Okay, so that's the website. I took a couple of snapshots from the overall bullet point document that they provide, and what you're seeing here is again this emphasis on phased mitigation. So what I want to talk about with that is, so we talked earlier about like recommendation of hybrid, remote, and traditional face-to-face instruction, right? And the county stepping back away from that and allowing for schools and LEAs to be making those decisions, local educational authorities, to be making those decisions for themselves. We're going to continue in that direction, and I think that there is a lot of overlap with what the CDC is saying in their updated guidance. In one of the sections for operational return strategies, which we're just going to shortcut down to right here, it talks about recommended implementation of mitigation strategies in K-12 school learning modes by level of community transmission. So this is the part that I think is going to need the most translation and most assistance in conveying the message from the health department out to schools and what the decision is that you all will be making. One of the things that I want to emphasize is, so we've talked about stepping away from recommending virtual, remote, hybrid learning strategies. If you read this box right here in the high transmission red, it says middle and high schools in virtual only instruction unless they can strictly implement all mitigation strategies and have few cases. Schools that are already open for in-person instruction can remain open, but only if they strictly implement mitigation strategies and have few cases. So those are the things that we've continued to say throughout this. That's the guidance that the health department has stuck to since June or July of the beginning of last year. Strong mitigation is the key point. I've heard multiple times now on the CDC call and in this guidance as they've been issuing it out that 6 feet social distancing is an absolute must in order to comply with this strong mitigation for either in-person or for hybrid strategies. So you've got to do this 6 feet social distancing if you want to do this safely. And there's no two ways about it. You got to do. Sorry. Here to meet. Thank you. Sorry about that. You have to do the masking. You have to do the 6 feet if you want to operate safely. There are no ways around. Okay. And yeah, I just did fix the sound. Sorry about that. What happens is if we get someone unmuted into the lobby, it can cause an echo. So if you are joining us, please make sure that you are muting your microphone. And a team on the call here, if you can just go into the participant list underneath the participants, and over on the right-hand side, you'll see little microphones next to folks. If you can just go through and help me manually mute those individuals who are unable to do that, that'd be helpful. Okay. Going back to some of these other guidance pieces, again, this is all from a 2-page handout that the CDC has provided that's on their website. It gives a really good example of a 30-foot by 30-foot classroom of how you actually distance out these desks in a social setting. And this is for K through 12, okay? If you're unable to do this for whatever reason, then it's going to have to be a creative fix. You're going to have to get creative around how you can make this happen in your classrooms and to do it equitably. So just keep this kind of guidance in mind as you're going back to your return for education. Okay. For our guidance overall, we're going to continue to go through this on our weekly meetings. We're going to implement some future trainings based on what the requests are for the county, for your schools. So if there are specific areas where you are wanting guidance specifically on mitigation implementation, then this session today and the session on Thursday and the emails are the ways to make those requests. So we will make sure that we get that information out to you based upon the request. I'm going to copy and paste the link for the CDC website here in the chat, just so folks have that. Oh, thank you. Perfect. Rebecca's on it. Okay, so that, just keep abreast of that. We're gonna keep doing these trainings. I have a team of new folks which I'm going to introduce here shortly, and then they'll be assisting us in developing and putting out some trainings in specific mitigation strategies related to populations at your sites. Any questions on that CDC guidance as of now? And please again know that there is going to be a lot more detailed information coming out from us in the next couple of weeks. To answer your question, Ms. McIsaac, we are currently in red, and I'm gonna, there's a slide on here that actually covers that. Vaccination overview. So what you're seeing here is a screenshot of the Pimas County Superintendent's Office schools promotion around vaccines. I'm gonna have Mr. Bevington talk about that for a little bit. Please remember that when you do this, though, if you submit some kind of screenshot around that, to not include the image of your vaccine card, because identity theft is a serious potential issue. So maybe just the sticker that you got vaccinated or some kind of image like that would be helpful. Mr. Bevington, if you want to unmute really quick and just give a brief update on the campaign.
Hi, everyone. Sorry for I'm receiving a call at this moment. I apologize. Uh, in any case, yes, the campaign is going strong. Matthew Stamp is collecting pictures of teachers who have just been vaccinated and getting those out on social media. We request that you keep the pictures coming. You can send them to matthew.stamp@pima.gov. I'll drop that in the chat in just do that. It's been a very effective and productive campaign, and it definitely sends a message of hope. So please keep them coming. We appreciate it. Thank you.
Yeah, agreed. And it's been cool for me to see folks that I know in the education system getting those selfies out there. It usually is accompanied with a smile. Um, Other updates, we've had 7,899 educators run through the Banner system. That's as of 2/13/2021. We've had over 8,000 at the various TMC run sites through the MyChart accounts. On average, that's over 62% of the population in K through 12 that we have vaccinated in the county. And we've done that in pretty much under a month. So it's been pretty incredible to see how much of the education population, K through 12, that we've gotten vaccinated. Um, it's important to note that on average, whether it's law enforcement, healthcare professionals, 75 and older, any of those populations, that there's about 20% of that population that declines vaccination for various reasons, whether it's myth, or whether it's religious, personal reasons, or medical reasons, things of that nature. So we're actually doing really well in getting our teachers vaccinated. It's also really important to note that vaccine cannot be tied to reopening of schools. Those two things are, from the health department perspective, a separate issue. Um, so that's an important thing to consider. Okay. Just to further address Sayur's question, and Kristen, I'm going to have you introduce yourself here in a little bit too, as well as the other folks. For the few cases criteria, there are two pieces that we are looking at from a health department perspective. It's a 10% threshold. So if you're at 10% of your population at your school site, as a positive case in a 21 to 30 day period, I think it's 30 days, sorry, 10% within 30 days have tested positive. That's one of those prompting points that we're looking at. So if you have 1,000 people at your school site, if we see 100 cases come from your school site, that's where we definitely have a point of concern with your site. The second thing to look at is the outbreaks. If we see 3 outbreaks over a 4-week period, again, that's a really important trigger point for us to look at and have a consultation with your site on whether or not mitigation efforts are being followed appropriately. Okay, so those are the two data points that we're internally examining with your school sites. Other points on vaccine, there is still registration open. There's some changes happening. The U of A is actually shifting over to the state system this week. So if you have teachers that are still looking to get their first vaccine and they want to do it at the University of Arizona drive-through pod, they're going to have to register at the ADHS, the Arizona Department of Health Services website. All of those registration links can be found on the Pima County Health Department webpage. I'll walk you through that in a little bit. A couple questions coming up about vaccines that I want to go back and address here. There is no danger of losing or delaying the second shot due to a shortage. The county has made it very clear that we are specifically focusing on second doses if there is a shortage like there has been. The state has shorted our supply over the past 2 weeks, so we have focused specifically on getting the second doses taken care of. So that won't be an issue. You may see a delay, but you have a 45-day window post when the second vaccine is done that you can still receive the vaccination second dose without any halt in efficacy. So if it's Pfizer, that's a 21 day from first vaccine to second vaccine. You have an additional 45 days if you don't get it on the 21-day mark to receive the second dose without any effects on the efficacy of the vaccine itself. With Moderna, it's 28 days. So again, you have a 45-day cushion post that 28-day mark to receive that second dose without any effect on the efficacy of immunity from the vaccination. So those are important things to note. Sarah, yeah, there's been all kinds of reactions to vaccines. If you go to our FAQ site, a lot of those are addressed. Question from Mr. Tucker. The question getting most is how the repurposing of the U of A site will impact people who have their second doses scheduled for that site. It will not affect that at all. If they had their first dose at the U of A, they will get their second dose at the U of A. For anyone who has signed up for a vaccine and has not received an appointment, they will need to probably re-register through the health department websites. Okay, so we will post some links into that for you, Brother Jesus, on how to access those. So if you haven't received your first appointment yet, you'll need to reschedule through the health department. And again, I'll walk you through that here. And right now, actually, while we're on this portion of the call, let me pull over the health department webpage. And so we're just going to go to the Pima County page here. From here, go down to COVID vaccine. I'm going to skim through this really quick. Registration for priority phase 1B. Scroll down to school and child care workers. And then you click this link right here, and it will get you to a place where you can register to receive your MyChart notification. Because of the lack of vaccinations right now, it could take up to 2 weeks for them to get that MyChart invite. Again, it's all about how much the state is allocating out to us. You will see the possibility of getting an appointment faster at the University of Arizona because they are directly supplied from the state, and they are a state-run pod. So the state is allocating those vaccines quicker to those pods for whatever reason. So definitely go to the registration for the state system, which is there'll be a button up on here for that here soon. Okay. If you want to make an appointment at Banner, you can click this right here, this button, and that'll take you directly to the Banner link. Again, we've had quite a few teachers make their appointments at Banner. Let me jump back over to the PowerPoint. Tiffany, your slide's up next. If you want to unmute and just give a quick rundown.
Good morning. So they are currently to date 3,426 cases. We have 59 outbreaks, and there's been still a downward trend within the last week. And we have 8 confirmed basketball games that have resulted in outbreaks.
Tiffany, can you repeat that number one more time? I charted the wrong number on here earlier from an earlier.
Sure, no problem. For the reported cases?
Yeah.
3,426 total cases.
Thank you.
You're welcome.
So a couple important things to note. We have seen an observable downward trend over the last 5 weeks. This is the data directly from the health department data slide. It shows that starting from January 4th, you can see where these cases have just been dropping more and more. Please note that the last 2 weeks in here, it takes us a while to catch that data up from the ADHS system. That's an important piece to note, but you should still see declining cases here as been reported by our epi department to us. The one piece that I want to harp a little bit on here is in the last 16 days, we've had 8 basketball games that have resulted in a quarantine of 16 teams with 2 confirmed outbreaks and potentially more that we're looking at. The CDC guidance specifically states that all sports right now are not appropriate, and that you shouldn't be doing those things. What I think from our perspective and the cases that we've tracked, basketball is the only one that we're really concerned about right now. Track and field, softball, baseball, outdoor sports, well, wrestling is the other one that we would be really concerned about. The data clearly is showing us that basketball is not a safe sport to play right now in any capacity. And the Arizona Interscholastic Association, which we have definitely had disagreements with in the past, their mitigation and their overall strategies are pretty solid, but their understanding of the case numbers and what that means and when it's okay to play sports is not accurate, and it's not based off of any kind of data or stats or science. The numbers that we have here are really clear. It's 16 days. We've had a total of 16 teams had to quarantine from exposures. So please avoid the basketball situation for right now. I think volleyball is something that we could potentially proceed with when we get to a lower level of community transmission as a whole. But there is some mandatory close contact that happens in volleyball, and we have seen exposures in volleyball games that have resulted in quarantines of teams as well. For any sport, if you decide to just ignore that recommendation, you should not have any spectators indoors watching games, because there's a max capacity of 50 in those settings that you can have in total. And once you get 2 teams in there, along with coaches, admin, athletic trainers, you're very quickly approaching that 50 number. So please do not have parent spectators if you choose to ignore our mitigation guidance and go ahead and proceed with those games. I can tell you that will also prompt further conversations from the health department. And we are actually going to be, now that we have more staff over here, going out to games and possibly photo documenting any of these violations to look for aggressively pursuing any method to enforce that. We don't have the mechanism for that right now legally, but we are going to be taking that on. The second thing that I can note is that with track, field, any outdoor softball, baseball related sport, you can have spectators at those events as long as those spectators are masking and socially distancing within those settings. And that is an area we will definitely aggressively pursue. So just please make note of those things. I definitely recognize the importance of sports. There are successful ways to implement wrestling and basketball, just not in competitive ways right now. So training is perfectly appropriate. There's tons of drills you can do with those sports to keep up the general fitness and the general support of those things. But yeah, those are important. Ms. McIsaac, you'll be getting this full PowerPoint later today. So just know that. There are no repercussions at this time, Mr. Kidd, although we are investigating heavily how we can make that happen. So I've been working with our county attorney's office and my leadership to try and find some way that we can enforce that, and we are working on it. In terms of the overall outbreaks, again, we continue to see overall evidence supporting that when strong mitigation is implemented, your case counts are going to be really low. In the 59 outbreaks to date that we've had throughout our schools since August, every single one of those has been in connection directly with mitigation that has not been appropriately implemented, whether that's social distancing or masking. So please make sure that you are doing those things. In total, we've had 3 student-to-teacher transmission cases for all of Pima County, and that's since August. 3 student-to-teacher transmissions. We are continuing to comb through a backlog of cases and data with our EPI department. We've backlogged at least, or we've come through at least 70% of the cases overall. So we feel pretty confident that this is a solid estimate. We may see a plus or minus or plus 2 in here, a standard deviation of a positive 2 factor on this. But we're feeling really strong about that transmission. The biggest sources of transmission within our community for schools continue to be social transmission, whether that's at home or within other social settings. ADHS Schools Dashboard, again, you're just seeing these declines in the overall case data. The PCHD data snap, this is a hyperlink, so if you go here and open the hyperlink directly, it's going to take you to this web page instantaneously. And then from here, the Pima County Data Dashboard is where you'll get some of those graphs that Ms. Isaac was asking about previously. This progress report is something I want to call some attention to, though. As of the update on February 11th, our healthcare system availability is in a good spot, and our public health tracking and prevention is also in a pretty good spot. So these metrics we're feeling really good about right now. We continue to see declines in each one of these 3 areas for the county. Okay, so that's county-related data. Casey or Julie, are you on the call today? I'm trying to scan through really quick.
Which Julie?
It's Julie?
Yeah, hi.
Hey, yes, awesome. So are you able to see the slides on this presentation?
I am.
Okay, great. Would you just go through and do your thing? I'm going to mute myself and let you do the talking.
Oh, okay. Somebody else. Testing is available. Obviously, the CDC recommendations are forthcoming, ongoing.
Oh, wait, sorry.
Yeah.
Is this Julie Kuderna?
Other Julie you need. Bye.
Oh, right. I'm sorry to put you in that spot, Julie. Yeah, never mind.
I was wondering, Brian. I thought maybe you were going to pick on me here for a moment.
Oh, not at all. Apologies. So Julie Kuderna is our testing manager. Obviously, she is super slammed right now, as is Casey McAnally. Kristen King, who you'll meet in just a little bit, will be assisting them with the implementation of this. But so testing is available. You all have been referring to the major sites overall, but we also are able to get point of care testing out to your sites directly with our Binax Now kits. Okay. So any of your staff can at any point go to any Pima County facility to get a PCR test quickly and easily. Your students can do the same. The PCR test is the only thing that will allow someone to release from early quarantine or for a symptomatic individual to test negative for a return to the school site. So please utilize those resources. We're getting a turnover testing results in under 24 hours right now. So if you take a test at 10 a.m., you'll have your results by 5 p.m. that evening from a PCR test, which is really solid, okay? For folks who are reporting to your site, on-site students or staff presenting symptomatic, you can now potentially integrate a Binax Now antigen test with results within 15 minutes. So what that means is if you have a student that shows up and halfway through the day they develop symptoms, the county can provide you with a number of testing kits that you can actually utilize on site after you take a training, and as long as you complete a waiver, a CLIA waiver, which is a certified laboratory waiver. We have enough staff now to assist with this specific implementation. So if this is something that you're interested in, if you have a larger district or a larger governing body that you fall under, like a diocese would be one example. Another example might be Lehman Academy or La Paloma, those various organizations. If all you got to do is email Casey McAnally, and we'll drop her email into the chat. Kristen King, actually, if you're on the call, if you can type Casey McAnally's email address into the chat and maybe drop yours in there too, contact one of those individuals and we can get you started on the process. It's all free. We wouldn't charge you anything for that, and it's pretty easy to conduct those testing swabs. Oh, there's Casey's email right there. So I'm just going to copy and paste and drop that into the chat. And for some reason, the chat's acting all funky for me right now, but that's all right. I think it's been muted. I will try to fix that here in a second. But when you email Casey or when you email Kristen, please include the information underneath this, okay? Again, we'll be emailing this PowerPoint out so you all can get that. Other information, reduce quarantine and close contact. Please remember to report all close contacts of just your staff and students at your school site, even if they're remote, to the county health department using the Qualtrics form. That close contact is 6 feet, 15 minutes or more within a 24-hour period with or without a mask. And again, the reduced quarantine graphic, which is continues to be a super helpful tool overall for our schools, right here. That's what it looks like. All right, so I have a couple of folks on the call that I definitely want them to introduce themselves. So Kristen, if you can just unmute really quick, introduce yourself to the team, maybe do a video chat with everyone so they can see you, and then we'll turn it over to you, Dixie, Sylvia, and Stuart as well.
Hi, folks. I apologize. I don't yet have a camera, but my name is Kristen. I am new to the team here at the Public Health Department. I am a student, and I will be working within the K through 12 schools liaison support system, but also specifically focused in testing. So feel free to route any questions to me about testing or about these new COVID guidelines as set by the CDC and the Department of Education. Again, my email is in the chat, and I'm looking forward to working with you all.
Thank you, Kristen. Dixie, you want to go next?
You want to talk?
Sure. Hi, I'm Dixie Siegel. Can you see me?
Yeah, there you are. Awesome.
All right. Yeah, Stuart and I are here together. He's having some technical difficulties with his computer. Yes, I am happy to join the team. We'll be working on data with exceptional and at high-risk students. And I'm a retired educator and then also worked for the Department of Ed on some testing, more achievement testing recently. And glad to be here. And I will put my email in the chat also.
Hi, I'm Stuart Sloniker. I'll put my email in the chat also. I'm also working with the school liaison team. I've got many years, about 25 years of experience in Tucson schools as a teacher. I have a pretty good feel for both private and public milieus. And we're going to be focusing, some of our focus is going to be on mine. I'm going to look at sports very closely, and we're also looking at exceptional ed considerations for mitigation.
Awesome, thank you both. Sylvia, if you're able to unmute, do a quick screen share and just so folks can see you too.
Okay. Hello, everyone. I am also fairly new. I am the K-12 vaccine liaison. Glad to be here, and I will hopefully will be talking to a lot of you soon. Nice meeting you all.
Sylvia is doing specifically tracking vaccine-related issues. So if you have vaccine-related issues, Sylvia will be your point of contact from here on out. I'll make sure to drop her email in the chat there. All right, so that's everything and everyone today. I know we're about 4 minutes over. Apologies for that. Please remember, we're going to continue to push out upcoming guidance, mitigation strategies, and just further breakdowns of the CDC guidance. In the meantime, we need to know what you are needing help on in terms of this CDC guidance, okay? So please email us at eoceducation@pima.gov, and we'll drop that email in the chat. Please email us at that email address, just giving us suggestions for what specifically within the new CDC rollout and that guidance that you're needing help on implementing. And we will get subject matter experts to the table to make sure we get that out to you, okay? Without any other further questions or comments, I'm going to stop recording at this point in time.